No, don't. Hey. Okay. That one's in just yet. So we're going to get prepared. Be prepared. All right, everybody. I'm not gonna lie to y'all. So I literally just walked in the house. Okay. Woo. All right. How y'all doing today? Hello. All right. So it is Thursday, which means we are here for NCLEX Jeopardy. Okay. And thank you for those that passed my NCLEX. Wow! Congratulations to you. Congrats. I've been getting a lot of people hit me up saying, "Oh my God, I passed my NCLEX! Yay!" So congrats to everybody that's passed their NCLEX recently. All right. So once again, this is Thursday. It's Thursday, so you are here for NCLEX Jeopardy. All right, and it is also week 4 of Camp Nursing School, and our topic for week 4 is pharmacology and dosage calculations. So we're just going to kind of mix those together, and we're going to have a pharmacology and dosage calculations themed, or whatever, that's going to be our questions, the majority of our questions for tonight's NCLEX Jeopardy. Okay? Yes, I've been well. How have you guys been? Oh my God. Hello. If you need help passing NCLEX, you are in the right place. Okay? You are definitely in the right place. I'm in the ER room watching you. Oh, wait, first of all, I hope you're okay. Number 1. Number 2, thank you for joining us. But go back to number 1, I hope you're okay. All right, so if this is your first time at NCLEX Jeopardy, please let me know. Comment down below that this is your first time. If this is not your first time and you've been here before, welcome back. Okay. Thank y'all for spending your Thursday afternoon or Thursday nights, evenings, whatever you want to call it, with me. All right, so NCLEX Jeopardy, little backstory, not backstory, but house rules, okay? NCLEX Jeopardy, that is basically our fun review for NCLEX / like your nursing school exams. And what we do is we go through questions. It's basically like a review, but we do practice questions, and we do it in the style of Jeopardy. So just like real life Jeopardy, all right, you have your blue screen, you have your categories, you have your, well, here we have our 5 questions per category, ranging from 100 points to 500 points. We are playing 4 points. The person with the highest score, highest amount of points at the end of NCLEX Jeopardy is going to be the winner of a free bundle, of a free Ultimate Nursing School bundle, or NCLEX Arcade if you have one and not the other. Okay, so like I said, we are playing for points, so it's every man for himself. How are we going to play? These are the rules. How we're going to play is that I'm going to pick a question from the categories, as you see. All right, so 5 categories, 5 questions, 25 questions. However, because this is week 4 in pharmacology and dosage calculations, we are playing majority pharmacology and dosage questions. Okay, they're just going to range from 100 points to 500 points. All right, now in order for you to answer and get the points, you have to answer correctly, obviously, but then you also have to answer the question correctly, and you have to say what is prior to answering. All right, so if the answer is number 3, or like the third option, A, B, C, or 1, 2, 3, 4, whatever. If it's C, if it's 3, you have to say what is 3, what is C, whatever. If it's fill in the blank, then it's not multiple choice. Obviously, it's fill in the blank. You just have to literally supply the answer, but you still have to supply the answer and say what is. Now, in the actual NCLEX, it's not going to be Jeopardy style. It's not. You're not going to have a blue screen or anything like that. It's just going to be straight up just NCLEX style. But this is just a fun way of practicing and reviewing the content, reviewing the information, without it being just so overwhelming and scary looking. Okay, so let's go ahead and get started. If y'all have any questions, just go ahead and comment them below, and either I'll answer them or one of our veterans will answer them. Okay, So I'm gonna, like I said, I'm gonna bring up the question. Make sure you read the answer choice, the questions and the answer choices, and then you say what is, and then you answer what the question. Okay. Now, just in case there is some lag, you can leave the live and then come back in. Or if there is some lag as far as the responses, I can only go by what I see on my screen, on mine. So if someone is first on my screen, but on your screen, maybe it's showing that another person's first and that person's second, I can only go based off what my screen shows, okay? So let's go ahead and get started. Now, like I said, this is majority like pharmacology, dosage calculations, because that's what we're doing that's our topic for week 4. So we're gonna go ahead and get into our pharmacology. Let's go ahead and start low and slow, okay? Let's go ahead and do our first question. It's for 100 points, not 10 points. My face is cutting it out. All right, you do not have to wait for me to read the question to answer. If you read the question and the answer choices and you know the answer, go ahead and answer and drop the answer in the comments, okay? So let's go ahead and get started. So first question, pharmacology for 100. Terbutaline is prescribed for a client with bronchitis. Which disorder in the client's medical history requires caution by the nurse? 1. Osteoarthritis. 2. Hypothyroidism. 3. Diabetes mellitus. Or 4. Polycystic disease. Okay, which disorder in the client's medical history requires caution by the nurse? Okay. What is our answer? So let's go back and really try to figure out what our answer is really, or what this question is really asking us to answer. So terbutaline, that's prescribed for a client with bronchitis. Okay. What kind of medication is terbutaline? All right, it's obviously something to treat with bronchitis, which would do what indication? Okay, so kind of think of that in your mind, and then knowing what kind of medication that is, which disorder below would, if it says requires caution by the nurse, that basically means which one would make the nurse think twice, which one would the nurse like not expect to see because maybe they are contraindicated, maybe they have, when given together or when one exists with the other, they have conflicting like adverse effects. What is it? So let's figure out what the answer to this question is. So Pharm for 100, the correct answer is, what is 3 diabetes mellitus? What is 3 diabetes mellitus? All right. So terbutaline is a bronchodilator. All right, bronchodilator. Use those common prefixes, suffixes, and root words we were talking about. Okay, even if you've never heard of a medication or maybe a class of medication, you don't know what it is. Break apart those words. Okay, broncho for bronchioles, and then dilator. Dilator. All right, remember, dilate is the opposite of constrict. Constrict means to get smaller. Dilate means to open. Okay, so bronchodilator is going to open your airways. It's going to open your bronchioles. Okay, so terbutaline, which is a bronchodilator, is contraindicated in clients with hypersensitivity to sympathomimetics. Sympathomimetics, all right? So hypersensitivity, that means you're allergic to it. That means you are allergic to it, all right? So it's contraindicated in clients with hypersensitivity to sympathomimetics, and it should be used in caution with clients, with impaired cardiac function, okay? So impaired heart function, the diabetes mellitus, hypertension, hyperthyroidism, or a history of seizures. Okay, this medication may also increase blood glucose levels. Remember, that question asks us to, for which of the disorders would cause the nurse to give it in caution, or with caution, I should say. And the answer, once again, it should be used with caution in clients with impaired cardiac function, diabetes mellitus, and hypertension. Okay, so not just this medication specifically, terbutaline, bronchodilators, period. All right, bronchodilators are always either contraindicated or just given in caution in patients with diabetes mellitus. Okay. Devon said, I've never heard of that medication. Never heard of this medication. That's probably correct. Okay, you won't learn / hear of every little medication, but you heard / will hear of bronchodilators in that class and what it does. Remember, biggest tip for when you're learning pharmacology, don't be so stuck on learning the individual medications. Okay, when you're learning them, especially when you're reviewing them, review them by class. Okay. See what y'all are saying. All right, cool. Let's see who got that one. Subtastic said, why was hyperthyroidism wrong? Was it hyperthyroidism? Was it hypothyroidism? Hold on. Choose a different one. It was hypothyroidism. Okay? Reading too fast. Reading too fast. All right, let's go ahead go to the next question. Oh, wait, no. Let's see who got this one right. My bad. Okay, who got this one right first? And the winner of these points, hold on, who got what is 3 first is... A lot of people chose what is 2. Who was the first person to choose what is 3? Wait. This is played every Thursday. AV88_13. Oh, I'm like, where's my scoreboard? Here it is. All right, congratulations, AV88_13. You are the first person to say what is 3. So you on the scoreboard with 100 points. _33, 100 points. Awesome job. Who else got what is 3? Smile 16, Pink Love, the Justice Cooper, Shanae 6286, Mrs. 716. Awesome. All right. So if you are new to, or if you're just joining the live, this is NCLEX Jeopardy. How you play is that when you read the question and the answers and you know the answer, you have to say what is, and then you have to put the actual answer. So if it's 1, 2, 3, or 4, you have to say what is, and then number 3. If it was this question, it would be what is 3. Okay, I can only go by what I see on my screen. So if somebody answers on my screen, and it's different from maybe how your screen looks, I can only go by what I see on my screen. So I'm going to call out the person on my screen that answers first is going to be the winner of those points. If you answer correctly, and that's all you care about is a review, have at it. Because that's really the ultimate goal of us doing this, just in a non-scary way. So don't lose sight of that. Now let's get into the next question. Boom. All right, next question. Now, this is Pharmacology for 200. Okay, the emergency department nurse is caring for a client admitted with DKA or diabetic ketoacidosis. The primary healthcare provider prescribes intravenous or IV insulin. The nurse plans to prepare which type of insulin for the client? 1. Insulin glargine. 2. Regular insulin. 3. Insulin isophane. Or 4. 50% human insulin isophane / 50% human insulin. Let's read that one more time. It says, we'll read the question. The nurse plans to prepare which type of insulin for the client? Let's look at the information they gave us. We have a client that's coming in that has DKA. The provider prescribed IV insulin. So what type of insulin? What type of insulin will we expect to be preparing for a client in DKA and via the IV route? Let's look at what that says. Okay, let's look and see what that correct answer is. And the correct answer is, drumroll please, what is 2 regular insulin? What is 2 regular insulin? Guys, what kind of insulin can be administered via the IV route? Regular insulin, okay? Insulin glargine, all right? That is a long-acting insulin. Remember, the client that came in, they were in DKA, and we were the IV that was going to be administered was not IV. I'm sorry. The insulin that was going to be administered was via the route, or via the intravenous route or IV. Okay. Insulin isophane and 50% human insulin isophane / 50% human insulin. Those are both intermediate acting insulins. Okay. Even if you didn't know which insulin was long acting, immediate, intermediate, fast, short, whatever, even if you didn't know that, at least know that regular insulin is the only insulin that can be given via IV. It is the only one that you can give via IV. Okay? So a lot of people is confused by number 4. But regular is the only one that can be given via IV. Okay? She was like, damn, I knew I should have went what was on my first mind. Don't second guess yourself. Don't second guess yourself. All right, first person to say what is 2 and to get these 200 points. First person on my screen to get it was thick thighs, and I lost it. Where'd it go? Thick thighs and peaceful. Congratulations and great job. And peaceful. 200 points. Awesome job. Who else got it? Even though you weren't first, or maybe even though you didn't say what is, you weren't the winner of the points this time, but if you got the answer correct, I'm gonna call you out, because like I said, that's the real test. We're testing your comprehension, not if you can play Jeopardy the best. You feel me? All right, so I am Abina, also got it. Regina Love, who else? Devon Charday, Blessed 185, Chrissy Bear, Ronnie M, Ajanetta, Nurse Major T, Lyric Doll, Mahogany Maiden, Naturally Nurse. Awesome job. Great job to you guys. If you didn't get it, like I said, like I always say, it is okay. I would much rather you get it wrong with me. Just as we're practicing, this is the perfect time to get it wrong. Okay, so you are allowed to get it wrong. It's okay, because honestly, that's how you learn the most and the best. You learn the best from your mistakes. So if you didn't know that, get this answer right. If you didn't know that regular insulin was the only insulin that can be given IV, now you know it. Now you know, so that when you take your real NCLEX, you won't make the same mistake. You won't get got twice. Okay? All right, so let's go ahead and get into the next question in that one. This one is, let me get it up. I'll say it. Okay, this one is a little bit of pharmacology and fundamentals. This one's about lab level, so this is why I want you guys to answer this question. And this question is select all that apply, just in case y'all didn't read it or read past it. This question is select all that apply. Okay, so as you can see here, we have 6 answer choices. It can be as little as one of these answers that's correct, or as many as all 6. Okay, Now, let's go ahead and get into it. This is fundamentals for 200. A client enters the emergency department confused, twitching, and having seizures. Upon assessment, flushed skin, dry mucous membranes, and an elevated temperature and poor skin turgor is noted. The serum sodium level is 172 milliequivalents per liter. Which intervention should the primary healthcare provider likely prescribe? Select all that apply. 1. Monitor vital signs. 2. Monitor intake and output. 3. Increase water intake orally. 4. Monitor electrolyte levels. 5. Provide a sodium-reduced diet. Or 6. Administer sodium replacements. Okay, so while y'all are answering this, let's go over some tips. Let's go over some strategies and some tips. Okay, so when you're reading something like this and it sounds a lot like a case study, okay, they're giving you like the setting. First, we know that the patient came to an ER department, whatever. Honestly, that part doesn't matter. They came to the ER department exhibiting these symptoms. They were confused, twitching, and having seizures. Okay? The other manifestations and symptoms that was noted upon assessment: flushed skin, okay, dry mucous membranes, an elevated temperature, and poor skin turgor. Okay, there's only a couple of things that should instantly pop into your mind when you see dry mucous membranes and poor skin turgor. Okay, this is where critical thinking comes in. All right, dry mucous membranes and poor skin turgor. Something should immediately pop up. Okay, what is it? Now, serum sodium level, that's 172. You got to think to yourself, okay, they gave us a serum sodium level, but I have to know what the normal range is so I know whether or not this falls in line with it or if it's outside of the range. If it's outside, is it too high or too low? Which one is it? Okay, so given all that, which interventions should the primary healthcare provider likely prescribe? Okay, so even though as nurses, we will not be doing the prescribing, especially if we're not a nurse practitioner. You got to be a nurse first before you're a nurse practitioner, so you should still be here. But what interventions do you expect for the nurse to take out? What orders do you expect to see that the provider prescribed based off of this assessment and these levels? Okay, we may not be able to prescribe or diagnose, but we can still assess, all right, and intervene. So let's go ahead and see what that question or that answer is, all right? And remember, this is select all that apply, honey bunny. So either you're going to cuss me out or you're going to be real happy that we did these, okay? So the correct answer is, drum roll, please. 1, 2, 3, 4, 5. So basically all except number 6. All right? All except number 6. And I'm going to show you a few ways. I'm going to walk with you of how we got to this answer. All right? So, first of all, I'm going to go back to the thing. All right, first of all, so serum sodium level is 172. What is the normal range of sodium? What is the normal range of sodium? And while answering that, I'm going to scroll all the way up and see who got this answer correct first. But drop what the normal range of sodium is. Who got 1, 2, 3, 4, 5? 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Smiles 16. Good job. Smiles 16. A whole bunch of Z's. You got 200 points. Awesome. Who else got 1, 2, 3, 4, 5? Mahogany Maiden. Jess RDZ 94, Regina Love, Lyric Doll, trying to see who else got it. 1, 2, 3, 4, 1, 2, 3, 4, 5. Yes, so yes, I see what y'all saying as far as the serum sodium level. 33, Pretty Natural also got it. Great. Okay, so yeah, so the normal level for sodium is 135 to 145. Okay. If you need help remembering the lab values, there's, for electrolytes and for just normal lab values, like 2 different things that you can get within the Ultimate Nursing School bundle that you can check out if you need help. I think honestly they're both within the pharmacology section. So if you need help trying to remember the electrolyte levels, definitely check that out. But normal levels for sodium is 135 to 145. So 172 lets us know that it is above 145, above the high end. So it is, we're getting an excess of it. We have more than the desired or required amount of sodium. So we have hyper, which means more than, natremia, sodium in the blood. Okay, so let me go back into the actual answer so I can read through it. So the answer is, once again, 1, 2, 3, 4, 5. Hypernatremia is described as having a serum sodium level that is above or exceeds 145 milliequivalents per liter. Signs and symptoms of hypernatremia would be dry mucous membranes, loss of skin turgor, thirst, flushed skin, elevated temperature, oliguria, muscle twitching, fatigue, confusion, and seizures. Okay, those interventions. I asked another question too. I said, when you see dry mucous membranes and like poor skin turgor, dehydration should be one of the first things that pops up. Dehydration is a medical diagnosis. Nurses cannot make medical diagnoses, but what we can say for someone that is that has dehydration, or that is showing signs and symptoms of being dehydrated, okay, like the dry mucous membranes, elevated temperature, loss of skin turgor, pulse, expect pulse to go up, expect blood pressure to go down. That wouldn't be dehydration for the nurse. That would be fluid volume deficit. Okay, fluid volume deficit. Now, interventions that would include monitoring fluid balance. Okay, how do we monitor fluid balance? Electrolyte balance. We're looking at electrolytes. Okay, we're monitoring those electrolyte levels. And then it says monitoring vital signs. Okay, we're definitely gonna do that because, like I said, elevated temperature, elevated pulse, and decreased BP. Those are all manifestations of dehydration or fluid volume deficit. So checking to see whether or not those parameters are still out of whack or back to normal would be one of our interventions. So monitoring vital signs. Reducing dietary intake of sodium. Okay, the last 2 options, number 5 was reduce dietary intake of sodium, and number 6 was sodium replacement therapy. Test taking tip, especially for NCLEX. Whenever you see 2 answers that are opposite of each other, then more than likely one of them's the correct answer, not both. One of them's the correct answer. So reducing the dietary intake of sodium and replacing sodium is 2 different things. One of them, you're holding sodium and putting them on a sodium limit. The other one is that you're giving them extra sodium, extra salt for you, love. So which one are you doing? Are you amping up my salt intake, or are you limiting it? Which one is it? It can't be both. Or can be? But for the sake of these questions. So when you have answers that are the opposite of one another, take a closer look at it, because it's more than likely it's going to be one of them. Okay, a lot of people chose 1, 2, 3, 6, or 1, 2, 3, 4, and didn't even choose 5 or 6. But when you have, like I said, when you have opposite answers, more than likely it's going to be one of them. Okay, and if you already have hypernatremia, which is excess salt in the blood, do you want to limit salt intake, or do you want to add on more salt to the already salty blood? These people are already salty. They are salty. They're mad about something. They're salty about something. You're going to add more salt or limit the salt. You're going to limit it. Okay? So yeah, sodium replacement therapy would not be prescribed for a client with hypernatremia, because that salt is already high. All right? Let me look and see what y'all saying. Oh, I see you too, J. Cole. Great job to everyone that got this one right. Great job to everyone that got 135 to 145. Love it. Great job. All right, does that make sense? Thumbs up if that makes sense. Oh my, we about to fall. Jesus. Okay, yeah. Thumbs up if this makes sense. And then we're going to go ahead and go into our next question. Great job. All right, so that was select all that apply. You guys have to be, especially for pharmacology and dosage calculations, you're gonna be introduced to fill in the blank style answers. Okay, this is an example of an alternative formatted question, or alternative format type of question. Multiple choice is usually like our regular schmegular. You also have select all that apply, which is multiple response. And then you have something else, which is fill in the blank or supply answer. And that's literally, I'm going to do what it says, fill in the blank. So you have to actually like just type in the answer or supply the answer. It's usually done with like any type of like numerical type of question. So pharmacology, and we're really more so dosage calculations, more so than pharmacology. You'll see a lot of this. You'll get a lot of practice in dosage calculations. So like I said, I'm here to help you guys practice it. I'd rather y'all get it wrong with me than on the actual test. So don't be freaked out, okay? So we're gonna practice some of our fill in the blanks, okay? Now, this is another question, pharmacology. This one's a conversion, like a metric conversion. I just posted a video, I think yesterday, about it. All right, the nurse is calculating a client's 24-hour fluid intake. The client consumed coffee, 8 ounces. Oh, I'll just say 8 ounces of coffee. 8 ounces of water, 6 ounces of orange juice for breakfast, 4 ounces of soup, and 8 ounces of iced tea for lunch, 10 ounces of milk, 8 ounces of tea, and 8 ounces of water for dinner. The client also consumed 24 ounces of water during the day. How many milliliters of fluid did the client consume in the 24-hour period? Fill in the blank. All right, fill in the blank. And you don't have to type milliliters. You can just type the number in. But remember to say what is. Nurse Majesty said, my weakness. Honestly, samesies. Samesies. Okay? And if you think that you will not see a lot of these questions in pharmacology or dosage calculations, you are so sadly mistaken. It's like they know that you hate these questions. They know that we all hate these types of questions, and they just give more. Thank you, more please. So just go ahead and just do yourself a favor and memorize those metric conversions that I put in that video a couple days ago, if not yesterday. Memorize that for conversion questions like this, so you can just take it and run with it, because these are not going anywhere. These are not going anywhere. All right, conversions are, but they're everywhere. Okay. So once again, we're trying to figure out this client's 24-hour intake, 24-hour fluid intake. Okay. So tip number 1, whenever you have these questions like this, when I'm gonna look at 2 different things. Okay. After I read through everything one good old time, I'm going to look back at the question, and I'm going to see all the different fluid amounts that they want me to add up. I'm going to look at those units and make sure they're all the same. Okay. So where it says the client consumed this much coffee all the way to the client consumed 24 ounces of water during the day, we have to add up all those liquids. Okay. They gave us what they had for breakfast, what they had for lunch, what they had for dinner, and then how much water they had throughout the whole day. So in order to figure out how much fluid that client consumed throughout that whole 24-hour period, we have to add up all those liquid amounts. Okay. Now, once I look at the units for the units of the liquid that they consumed, I'm going to look at the units of the liquid that they want us to figure out. All right. So what they gave us is the units of liquid in ounces. Okay. What they want us to supply them, what they want us to supply the answer with is milliliters. So somewhere on the way, or right before we answer this question, we have to convert ounces to milliliters. Okay. Do y'all know how to convert ounces to milliliters? Do y'all know what the conversion is for ounces to milliliters? Drop it right now. How many ounces are in a milliliter, or vice versa? Whatever. How many ounces equals how many milliliters? Okay, that's what we gotta ask ourselves. So, what is the answer? Well, first, let's do a couple things. Let's go ahead and just, because I won't be able to see it. Let's add up how much fluid in ounces. All right, so we know. Let's get our calculators, because I'm not doing this by hand. Y'all can do it if y'all want, but I'm not. 8 plus 8 ounces plus of coffee plus 8 ounces of water plus 6 ounces of orange juice. That's for breakfast. Plus 4 ounces of soup. Ooh, was a broccoli cheddar. Plus 8 ounces of iced tea. I hope it was sweet, for lunch. Then they had 10 ounces of milk. Yeah, okay, I got lost. 10 ounces of milk, 8 ounces of tea, and then 8 ounces of water for dinner. All right. The client also consumed 24 ounces of water during the day. Okay. So when we add all that up, that gives you how many ounces? That gives you 84 ounces. All right. So that's how much fluid that client consumed during that 24-hour time frame. 84 ounces. So now we have to figure out 84 ounces. Now we're trying to figure out how many milliliters that equates to. 84 ounces equals how many milliliters? X milliliters. And that X milliliters is what they want us to answer. Okay, so let's go ahead and see what that answer is. And the answer is, what is 2520? Okay, so we already did that first part, which was figure out how many ounces of fluid they consumed, and the answer was 84. To go from ounces to milliliter, we would use the conversion that 1 ounce is equal to 30 milliliters. Okay? You don't have to memorize every conversion, but there's a couple that you definitely need to know. All right? Definitely need to know. You definitely need to know ounces to milliliters. So 1 ounce equals to 30 milliliters. Go ahead and just stick that in your brain. You need to know it. It don't matter if you're RN, LPN, president, it doesn't matter. You need to know it. You need to know that. You also need to know that 1 pound is equal to 2.2, or 1 kilogram is equal to 2.2 whatevers. You need to know that too. I think it's 1 kilogram is equal to 2.2 pounds. But boom, you know that. So since we know that 1 ounce is equal to 30 milliliters, and we know that we have 84 ounces, all we have to do is multiply 84 by 30 to get our milliliters. So 84 times 30, 2520, 2,520 milliliters. That's going to be our milliliters. That's our answer right there. Okay. Let's look and see who got that first. Rome_Italy. All right now. Rome_Italy. Great job. This one's 100 points. That one should have been 200, to be honest. That shit was not. Awesome job. Who else got 2520? Wait for it. I am Abina. Melodious Melody. Pink Love. Kaden Cruz. Nita 901. Pretty Green Eyes. Septastic. Some good questions this week. Thanks. I try to give good questions every week. Right, that was definitely more than, I'm not even gonna play you like that, Rome, Italy. That was at least like a 300er. I'm not even gonna play you like that, Rome, Italy. Like, and it was supplied, fill in the blank. I'm not even gonna play you like that. My bad, my fault. Okay, you got 300 points. So Rome, Italy has 300. Thick Thighs and Smiles both have 200, and then AV88 has 100. All right. That was a good one. So I don't know who was all not signed up for camp nursing school, but in your first camp activity, aka your pharmacology pre-quiz, one of the questions has to do with conversions and like fluid intake. So that's definitely a question that you need to know, which is why it was on your pre-quiz. Okay. All right. Next question. This one. Here we go. All right. Another one. Dosage calc for 300. All right. This is another fill in the blank. The nurse is checking the remaining volume in a 1,000 milliliter intravenous bag that is scheduled to infuse over 8 hours on an electric infusion pump. The nurse has just noted at 11 a.m. that the remaining IV fluid is at the 500 milliliter level. At 12 o'clock noon, at which numerical level in milliliters should the IV fluid be? Fill in the blank. Fill in the blank. Okay, they want us to know, they want us to tell them that at 12 o'clock noon, which numerical level in milliliters should the IV fluid be? Please note that they're not asking for how much IV fluid already infused. They're asking for how much IV fluid is left in that bag. All right. The starting volume is 1,000 milliliters. Okay. It's scheduled to infuse over 8 hours on an electric infusion pump. All right? Little tip. Whenever you see that, whenever you see a question like that and they don't automatically give you the drip rate, it's because you have to figure it out. Yeah, you have to figure out what that drip rate is. So you have to know how to figure it out. You have to know the equation. You have to know the formula. Okay, and honestly, it's the formula is just kind of like common sense. All right, if you have 1,000 milliliters of fluid, and it's ordered for that full 1,000 milliliters to be infused over a total time of 8 hours. You have 8 hours for 1,000 milliliters to be infused. How many milliliters infused per hour? You're picking up what I'm putting down? You picking up what I'm putting down? Okay, cool. So let's go ahead and figure out what this answer is. All right. So this was Doshitz's Calc for 300, and the correct answer is, what is, drumroll please, 375 milliliters. That's how much fluid is left in that bag. All right, we're gonna draw today. Y'all know I'm a visual person. Y'all know I'm a visual person. Just gonna get my 1 second. All right. One sec. All right, so this is our bag of fluid. All right, so this is our bag of fluid. Okay. 1,000 milliliters. They told us that they want 1,000, this full 1,000 milliliters of fluid to infuse over 8 hours. Okay, so if we know that 1,000 milliliters, to figure out what the actual drip rate is, or the rate is, but they want 1,000 milliliters to infuse over 8 hours. So 1,000 milliliters divided by 8 hours is going to give you 125 milliliters per hour. So that is your hourly rate for this. Okay? So we know that 500 milliliters is the halfway point between you starting this infusion and then finishing it. Okay, we know that 8 hours is the total time, so we know that at 4 hours, 4 hours past whatever time you're starting, at the 4 hour mark, you should be at the halfway mark, because halfway is 4 is halfway of 8, so 500 is halfway of 1,000. So after 4 hours, you should be at 500 milliliters. Okay, that's your reference point. All right, so the question wants us to know, hold on, let me go back to it because I forgot. Doshitz's Calc. Wait, let me go back. Boop. All right, so this was at 11 a.m. This is at 11 a.m. that they noted the 500. Okay, now I know. I remember it now. Let me go back to the question. Okay, yeah. So if this was at 11 a.m. and it was at the halfway mark in the halfway time, and we know that it's going at a rate of 125 milliliters per hour, they want to know that in the next hour from now, which is at noon, which is in 1 hour from where it's at right here, how much would be left? How much would be left? So if we know that there's 1 hour difference between 11 a.m. and 12 o'clock noon, and if it's a 1 hour difference, we know that it would be 125 milliliters that infused in that time. What we're going to do is subtract 125 from the 500 milliliters, okay? Because 1 hour passed, which means 125 milliliters must have infused. So 500 minus 325 is 375. And that's going to be 375. 500 minus 125 is 375. Okay, that's going to be the amount of fluid left in this whole bag at 12 noon, which would be 5 hours after they started it. Does that make sense? That was my little drawing. All right, so let's see who got that first. I'm happy you explained it. Awesome. I'm glad y'all got it. 375. Awesome. Yep. Right what C. Wayne said. Great job, C. Wayne. All right, so let's go ahead and see who got, what was the answer again? 375 first. Yep, C. Wayne. All right, C. Wayne. 300 for you. Great job. Who else got 375? Melodious Melody. 33 Natural. NC Pink Rose. Destiny. I Am Abina. Baby Assad. Pink Love. Septastic. Shanae. I Am the Ambitious One. I don't have to explain it. Yep, awesome. Perfect. Now let's go ahead and get into our next one, which is, I don't remember what it was. That was dosage calc for 300. What's this? Okay, next one. All right, this is pharmacology for 400. The nurse is collecting subjective and objective data from a client and notes that the client is taking abacavir. It sounds like abracadabra, but okay. The nurse determines that this medication has been prescribed to treat which condition? 1. Otitis media. 2. Heart failure. 3. Urinary tract infection. Or 4. Human immunodeficiency virus, aka HIV infection. All right, pharmacology for 400. This medication, which is the abacavir, has been prescribed to treat which condition? So that medication treats what condition? So you'll there's two ways for you to know this. If you know it, if you know this medication specifically, great, then you'll know what it's for. Not when I say specifically, I mean like you know specifically about this medication, not that you specifically take this medication. Okay. And then, you know this because of prefix, suffix, root word, that stuff, drug classifications, pharmacology classifications. So let's go ahead. I'm seeing lots of 4s. I'm seeing some 3s too. But yeah, I'm seeing lots of 4s. Let's go ahead and see what this answer is. Abacavir. And remember, on the NCLEX, you're only going to see generic medications. You're only going to see the generic names of drugs and medications. You will not see the brand. I personally suggest learning both. Generic for the NCLEX and nursing school and all that. and then brand for you / when you're doing patient teaching, because A is usually a word that's easier to say, and that's just what, like, commercially is that's the name that's pumped. So that's just good to know which is which. What was this again? Okay, at Pharm for 400, and the answer is, drumroll please, what is for HIV infection? And what is for HIV infection? Who's first person to get this? Smiles 16, who's already in the scoreboard with 200. You already add another 400 to your score, so now you have 600. Great job, Smiles. Who else got it? Like I said, almost everybody, but we all gonna get called out. Mahogany Maiden got it. I Am Abina. Tattoo Pooh. Melodious Melody. J. Cole. I Am the Ambitious One. C. Wayne. Blessed 185. Shanae. Kaden Cruz. Don't forget to say what is if you want points. Ronnie M. Call Me Ken. Cows. Certainly me. Great job, everybody. All right, so yes, HIV infection. That's what that abacavir medication is used for. All right, so first things first, HIV. That is a viral infection that can cause full-blown, can cause AIDS, which stands for Acquired Immunodeficiency Syndrome. It's a viral disease that destroys T cells, thereby increasing the susceptibility to infection and malignancy. Okay, so right, exactly. Whenever you see any, whether or not you know the specific medication or not, or you think you don't know, because sometimes like you'll know what a medication is and be like, what's that? But you're just seeing the generic, when all along you know in your head the brand. For example, do you know how many people did not know / do not know that diphenhydramine is Benadryl? Case in point. So abacavir, whenever you see an antiviral medication, the suffix is going to be avir, like VIR, avir. Like, for example, the medication for like cold sores, cyclovir or valcyclovir. Okay, that vir, VIR, think about VIR, virus, viral. All right, those are antivirals to treat a viral infection. Okay, so whenever you see a medication that ends in VIR, a cyclovir, yes. Whenever you see VIR, think about viral, virus, whatever. But just think about that to help you to help jog your memory. All right. Once again, abacavir is an antiviral medication and is used to treat HIV infection in combination with other agents. Okay, it is not used to treat the conditions noted in the other options. All right. One big thing that I do want y'all to know in real life and for the T's, antibiotics don't do anything to viruses. Okay? So you cannot get an antibiotic to treat a viral infection. Just like you can't get an antiviral to treat a bacterial infection. Okay? You can't get abacavir, acyclovir to treat bacterial meningitis. It just does not work like that. It doesn't. Okay? Antibiotics will not help you with the flu, which is a viral infection. Okay, I just want to just say that just real quick. Okay? Stop calling y'all doctor's offices demanding for antibiotics for a flu. Don't work like that. All right, next question. And whenever y'all graduate, because first of all, everyone here is going to become amazing nurses and graduate and do all that great stuff. Whoever decides to go the route of working in a doctor's office, think about this moment, think back to this moment, and then just send me a DM and just be like, Sam, you were so right. Like, you were so right. I just do that for me, please. Thanks. All right, next question. That was those. Okay. Let's do this one. Pharmacology for 300. Yes, positive affirmations. Oh, absolutely. It starts right here with the tongue. Everyone here is passing with flying colors, getting jobs, the jobs that they want, non-toxic jobs. You gotta speak it into existence. Okay, you don't need a manifestation journal to manifest what you want. Okay. All right, so the nurse is reviewing the medication record of a client with acute gastritis. Gastritis. What does that mean? Suffixes and prefixes. Gast and then itis. Put together, what does it mean? Which medication, if noted on the client's record, should the nurse question? All right, 1, digoxin. 2, furosemide. 3, indomethacin. Or 4, propranolol hydrochlorothiazide. Hydrochloride. What? 1, 2, 3, or 4. Don't forget to say what is. I'm getting a little bit of everything. Let's go back. All right. The nurse is reviewing the medication record of a client with acute gastritis. That's a disorder that they have. That's what they have right now. Acute gastritis. C. Wayne said inflammation. What does gast mean? Whatever. Their gastric area is inflamed. The stomach is inflamed. The stomach hurts. I'm just kidding. But yes, the lining of their stomach is inflamed. That's what acute gastritis means. Okay? And acute versus like chronic. That acute means it is a it's been like a short term, all of a sudden, not expected thing. They haven't been suffering from this chronically for a long time. This is definitely like out the blue, and I won't say random, but it's definitely like a random occurrence, I should say. So yes, so we know the client has inflammation of the stomach lining. So what medication, if we saw it on the client's MAR, the medication record, which one would we question? Like, this doesn't go. And what that really means, what you have to think about is when you see questions like this that are asking this specific question, which medication or whatever is should the nurse question? You want to think about it in terms of which one doesn't belong. Okay, which one should she be like, are you sure this should be here? Because this doesn't look right. You're giving it a second look, second guessing this specific thing. In this case, we're second guessing this medication. Like, this medication should not be taken with the person that has acute gastritis. Is it digoxin, furosemide, indomethacin, or propranolol hydrochloride? Okay. Let's go ahead and see what the answer is. Which of those medications should not be taken by a person that has acute gastritis? And if we saw it, we would question it. We would flag on the play. Okay? This one. And the answer is 3. So I'm between 1 and 3. Why 1? I'm between, the answer is, what is 3 indomethacin? What is 3 indomethacin? All right. So, indomethacin is a part of a specific class of drugs called non-steroidal anti-inflammatory drug. Okay. I know that gastritis and that itis, you may want to say like, oh, that's inflammation. They have, inflammation of the stomach. So you would think to give them an anti-inflammatory. That's not how that works. So NSAIDs, which is the non-steroidal anti-inflammatory drugs, short for NSAIDs, can cause ulceration of the esophagus, stomach, or small intestine. Okay, it can basically like cause an ulcer. All right, ulceration. It will burn a hole into the lining of the esophagus, stomach, or small intestine. Okay, it's not fun. So whenever anybody has like a pre-existing ulcers in their stomach, or if they have just honestly GI disorders at all, especially dealing with their lining, NSAIDs are usually contraindicated because it will cause GI upset, which is why sometimes they're like, eat food with it, blah, 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 to kind of coat your stomach before taking, medications like NSAIDs that are just rough on that lining, to try to like give it like a buffer and coat it. But if you already have GI issues, if that GI wall is already all types of messed up for whatever reason, adding something onto it that's known to cause further disruption to that lining or just your GI in general, that's contraindicated, which means no go. You don't want to do this. Okay, so indomethacin is a type of NSAID, which is contraindicated in clients with GI disorders due to the fact that it can cause ulceration. All right, it can cause ulcers, GI ulcers. All right, now digoxin, that's a cardiac medication. They can get that. That's fine. Cardiac medication. Let me not say cardiac. Let me say specifically, digoxin is not contraindicated in someone with GI ulcers or GI disorders. Same thing with furosemide. That is a loop diuretic. Okay, diuretics are what do diuretics do? All right, give me the use, the indication, not the indication. Just give me the action or the use of a diuretic. What does diuretics do for you? Okay, what is the purpose of a diuretic? Right, well, diuretics are a water pill, and that's to diurese fluids, which is remove fluid. All right, it helps you lose water in whatever way. And a lot of times if you have like a diuretic, you're excreting that water through your urine, so it's going to make you pee a lot. You are going to be urinating a lot, whether it's a pill or IV, whatever, but furosemide. Okay, you probably know furosemide by its brand name. What's the brand name of furosemide? Once again, you'll only see generic on the NCLEX, but in your mind, you may have learned it just by the brand. So just know both. Furosemide is the generic for Lasix, absolutely. All right, and that's a loop diuretic. Propranolol hydrochloride. Damn, they told me. Damn, I was hoping they would just say it was a antihypertensive. Let me see. All right, no, it literally says it. All right, it's an antihypertensive, but it's specifically a beta adrenergic blocking agent. So it's a beta blocker. It's a beta blocker. All right. How do we know that a medication is a beta blocker? What's the suffix for beta blockers? What's the suffix for beta blockers? Go ahead and get right. OLOL, LOL, whatever. Yes. LOL or OLOL. That is the suffix for a beta blocker. All right. So what's metoprolol, metoprolol, however you say it, olols. Yes, that is the suffix for beta blockers. So that's kind of how you know classes. Make sure you know your classes. Did y'all do your, if you're signed up and registered, completely free, if you're registered for camp nursing school, you should have did your pre-quiz. You should have also did your worksheet, your activity worksheet for the drug classes, where you have to match them up. All right? Match them up. I'm thinking y'all did it because y'all are killing these drug classifications. But yeah, you're matching the drug class with the suffix. That's what you're doing for the drug classification camp activity. Okay? Make sure you do that. What's today? 24th? Because I think it's due today. Make sure you check your newsletters. And you watch both replays. That's what I'm talking about. Check it. I'll let y'all know. Check your email again because you're going to have another email an assignment tonight. All right. So that one. What was this? Pharmacology for 300. Did I say who got this one? Let me look and see. I don't remember. Let me just scroll all the way up, child. Did I say who got it? Wait, hold on. Hold on. Wait, no, I didn't get it. The first person to say 3 was Cows 2421. All right, Cows 2412. My bad. 300. Pink Love 1223 also got it. Mahogany Maiden, Certainly Me, Below, The Signing Pro, I Am Abina, NC Pink Rose. Great job. Awesome job. You will be able to watch this live, but not immediately. It'll be available on my YouTube, which is, you can find that at, you'll just type in thenursamtv.com or search for The Nurse Sam TV on YouTube, but you can type in thenursamtv.com and it'll go straight to my YouTube. But Cows, you got 300 points. So, Bricky Biceps. Awesome! Woo-hoo-hoo-hoo-hoo. Thank you, Bricky Biceps. All right, guys. So, so I have one question left, but I think this was last week. I have one question left, but it is a fundamentals question, and it's to test those that were here like 2 weeks ago for NCLEX Jeopardy. It's to test y'all to see if y'all still remember this specific section. So if y'all want me to do that here, let me know if y'all want me to do it here, or if y'all want me to put it in my stories. Do y'all want me to do it here or in my stories? Just in case, like, you know, maybe you missed it 2 weeks ago. You don't want to do that. Let me know if you want to do it here or in my stories. I'm going to do it both. Like, I'm going to definitely do it in my stories. But just let me know if y'all want to do it here as well. Like, who was here 2 weeks ago? All right, I got 2 heres, 3 heres, 4 heres. Let me get a 5th one. 5 heres. All right, let's go. Let's go. Let's do it. All right. I'm going to do it. I'm doing both, honestly. All right, so the clinic nurse reads the results of a tuberculin skin test performed on a 5-year-old child who was at low risk for contracting tuberculosis. The results indicate an area of induration measuring 10 millimeters. How would the nurse interpret these results? 1, positive. 2, negative. 3, inconclusive. Or 4, requiring a repeat test. What is our answer? Let's see who remembers us going over this. This was not the exact question, by the way. Same concept, but like I always say, you never know. Like, questions are never repeated. Like, the questions are never repeated for on the NCLEX. Concepts are repeated. Like, you're not going to get the same question that I got, but what you will get is the same concept, and maybe they switch out a couple details or something like that. They switch out the age, they switch out something like that to really test you to see if you really comprehend, if you really know and understand the material. Okay, all right, let's look and see who got this one. All right, and let's make a bet. If you got this wrong, you have to join camp nursing school. Let's make a deal. Deal? Say deal if you promise. You have to join. You have to register for camp nursing school if you get this wrong. Say deal right now. I'm just kidding. All right, so the answer is negative. The answer is what is 2, guys? Negative. Oh, I knew this was gonna get y'all. You know why? Because it got me too. So this is how I got. All right, so induration, that measures 15 millimeters or greater and is considered positive in a child 4 years or older who has no associated risk factors. I know. Last time we did this question, actually no, I'm not gonna say it because I'm gonna put it back in my stories. Christian said, camp, here I come. Period. Y'all promised. CampNursingSchool.com. See you there. See you there. See you there. I will see you there. I will definitely see you there. So we had this, right. We had this question, same setup, but the induration, the measure of the induration was different. So no trust is different. That is number for that age. 3 years or younger for 10. You're right. You got. Remember, it's 4 years is going to 4 years old, or is going to be like your mark. If it's 4 years or older, then it's gonna be different. If it's 3 or less, or it's lower than 3, it's a different result. See, watch. Hold on. Let me show you. Wait for it. Wait for it. Wait for it. Hold on. I am. No, that's T's. Wait. I'm gonna get the other one. Hold on, because it has the explanation. Y'all know I'm a visual person. Wait for it. Wait for it. All right. Here. Okay. This was the other question that we did a few weeks ago. you see, it says it's a 3-year-old child and that the induration was 10 millimeters. Try to figure out what that result is. So based on what y'all just saw, what's the answer to this one? What's the answer to this? Based off what we just did. What's the answer? See, Wayne says 1, which is positive. Come on. Three-year-old child. And it's measuring 10 millimeters. Is that positive, negative, inconclusive, or does it require a repeat test? All right, majority of people saying what is 1? I only got 1, what is 2, which is negative. But let's go ahead and get into why the answer is what it is. And the answer is, and then we're going to go, I promise. But I just want to make sure y'all know. All right, so the answer is what is 1 positive? Okay, so now let's get into the rationale. So induration measuring 10 millimeters or more is considered positive in children younger than 4 years of age. Okay. And in children with chronic illness or a high risk for the exposure to the tuberculosis. A reaction of 5 millimeters or greater is considered positive for the highest risk groups, such as children with HIV or any other type of immunosuppressive conditions, such as like cancer or something. And then a reaction of 15 millimeters or more is positive in children 4 years or older without any risk factors. Screenshot if you need to, because a lot of us got that one wrong the first go round. Okay, so what you have to take in account is how old the client is, the reaction size, and if they have any risk factors. Okay, so how old they are. If they're 4 or older, they would be considered, I guess, an adult. All right, and then younger than 4, that would be like a children's result. You also have to look at, once again, the measurement and the size of the induration. All right. But also relate that back to if it's children or adult. All right. So if it is 10 millimeters, 5 millimeters, or let me go in order: 5, 10, or 15 millimeters in larger. And then you have to take into account whether or not they are at risk / at risk. Do they have a low risk? Do they have a high risk? High risk is if they are immunocompromised, cancers, HIV, anything like that, or like the chance or the risk of exposure is high. If they're already immunocompromised, then the size of the induration doesn't have to be as big as if they weren't without any risk factors. Does that make sense? They have no immune system. So even just the smallest raise would be like, that's definitely a reaction. Does that make sense? Okay. Sad participant, I haven't learned it. Technically, if you participated, you technically learned it. No, I'm just kidding. But this is how you get ahead of the game. That's why we do these, so that when you do review it, you look like you've been here before. You'd be like, oh, yes, I reviewed that 2 months ago with Nurse Sam during NCLEX Jeopardy. So all of you that are just confused and don't understand it, they don't get it. You're wasting my time and my precious smarts and brains. All right, so that was, I want to do that last question. But yeah, I want to do that last question and then roll into our goodbyes. Okay, that just the theater major always comes out, period. Let's go ahead and get into the facts. We only played a few questions. If you guys want to play the full 25 questions, make sure you download the Nurse Sam app. We have, okay, Nurse Bridgerton, that's what it was giving. Okay, that's what it was giving. Make sure you download the Nurse Sam app. It's free to download, so you can play the full version of NCLEX Jeopardy. All right, it's exclusive to the app. You cannot play it anywhere else. You have to download the app to do it. So we will be practicing, like I said, pharmacology and dosage calculations this round. So you'll get more questions. You'll get all 25 questions to really practice that. I'll also be putting some more questions in my stories to give you more practice. Okay, hold on one second. The person that won with the most amount of points was Smiles 16 with 600 points. Whoop, whoop, whoop. Congratulations. I don't remember if you've definitely won before. Do you want to donate your prize down to the next runner-up, or do you want to get something that you haven't gotten? Because I don't remember if you have both the NCLEX Arcade and Ultimate Bundle. But if you have one and not the other, then you can get the other. So let me know how you want to do that. Okay. Yeah, let me know. While everybody else is here, okay, remember, y'all promised y'all gotta join Camp Nursing School. This is the last week of Camp Nursing School. This is week 4, and we are going over, and the topic that we're focusing on is pharmacology and dosage calc. So if you didn't do too hot during tonight's NCLEX Jeopardy, definitely consider joining. It's free to register. You get camp activities. We do a camp assembly every week, which is on Sundays right here on Instagram Live at 6 p.m. Eastern Standard Time. And we go over another topic that's usually like difficult to learn or something that you really need to touch on. This week, our camp assembly will be a pharmacology game, kind of just like this one. We're just going to do it again in different questions. And then this week's giveaway, I am running the stethoscope giveaway back. So if you did not win the stethoscope, the 3 stethoscopes from 2 weeks ago, that was week 2, here's your another chance, okay, to win a free Littman stethoscope just in time for this next semester. All right, whether you started this month or you start next month for your first semester or your next semester, winning a free stethoscope will definitely help. So make sure you register so you can qualify to be among those that are pulled at random to win the 3 free stethoscopes. Okay, and it's not just a cheapy stethoscope either. It's a legit Littman. Okay, agenda first week. We appreciate you. Oh, I'm so glad. This is for you guys. All right, I did Camp Nursing School because I want you guys to be as prepared as possible. All right, I know, especially like on social media and word of mouth, people can like freak you out about nursing school, and the fear can have you and the anxiety can have you all over the place as far as like preparing yourself and making sure everything that you need to have ready that will actually matter is ready. So I want to make sure I gave you guys kind of like a summer camp to get you guys prepared for it. Not as intense and as like high anxiety as like a boot camp, but something fun, but still to get you ready and still to put you in the mindset of this next semester, kind of like your last hoorah before going into the semester. And so that's why I want to make it summer camp themed as opposed to like boot camp themed. So we had 4 weeks and this is our 4th week. And like I said before, our topic is pharmacology and dosage calc. We're going over everything that you need in order to be as successful as possible and how to ace pharmacology. Okay. If you have registered, make sure you complete your pre-quiz the drug classification worksheet and watch, at this point, both part 1 and part 2 of pharmacology. Your next activity, the next replay you'll be watching is the dosage calculation one. So make sure that you add the email that we're sending to you, add that email address to your contact list or to your email list so it doesn't go into spam or another weird folder, so you can get everything that we're sending. All right, so thank you for coming to NCLEX Jeopardy. If you want to get an actual study kit to help you with dosage calculations and or pharmacology, I recommend you either getting the first semester bundle or get the Ultimate Nursing School bundle, which the first semester bundle is included in the Ultimate bundle. All right, the Ultimate bundle includes everything first, second, and third semester, and first semester is just first semester. All right, but that's the best and the most cost-effective way to get pharmacology and dosage calculations, since those are two separate study kits. All right. What color stethoscope do I have? I have a few. I have like a light purple, and then I have a black, and then I have a white MDF as well. But the winners of the stethoscope, you get to pick your colors, so whatever. All right, thank you guys so much, and join me Sunday for a camp assembly, and then join me obviously next week Thursday for another round of NCLEX Jeopardy. Don't forget to download the Nurse Sam app to play the full 25 questions. Thank y'all. I'll see you later.